Hi, I'm Dr. Jim Hoven, your host of the Difference Makers podcast. This is a place where people come together that are making a difference for those who want to make a difference. And that's you. We're bringing thought leaders together in a sense of fusion where ideas and concepts and personalities are all driven together into one place at one time. And this is no different. In this episode, you're going to see cool things from cool people making a difference. Hello, Difference Makers. I am back with a very special guest. If you can see us, you can see my special guest here. And in fact, he's not really my special guest. He's actually my boss, and it's his podcast, but I get to run it every week. So I have with me Dr. Joe Ramos. And so for those of you listening, you're going to hear some incredible insights today on what we're calling integrative medicine. Now, what that means is when you go to somewhere for injuries, specifically we'll talk a lot about trauma today or chronic care. There's a lot of different ways that you can skin that cat and a lot of different means to get better. And what we've found, and this is where we live every single day, this is our bread and butter on taking care of people who have been injured, helping them find care that works best. Because both of us have been in the medical world for a long time. Him as an ER, basically the ER rock star, running an ER at a hospital, doing all this. Me as a chiropractor, we've had the chance to work with all the disciplines, doing all the things, and we want to share some of those insights with you today. So whether you've been in a car accident, you know someone who has, you have chronic injury from a fall a long time ago, we hope this episode brings great value to you. So without further ado, I can't wait to get into this with my awesome boss, friend, brother, partner, everything, Dr. Joe Ramos. Dr. Ramos, welcome.
Thanks. Thanks for having me. And I'm obviously very excited to talk about this with you because our roots go back to working together in a way that I can't say a lot of medical providers can even say.
True.
Medical doctors and chiropractors sometimes haven't always seen eye to eye, and there's been a little finger pointing across the two disciplines, particularly back when we started practicing.
Yes, yeah. Most definitely.
Yeah,
it's been great to watch it grow, right? That relationship between provider types. Finally.
Yes. Yeah. I don't want to exaggerate, but we were in many ways like icebreakers in some of this area. Dr. Hoven and I, as a little background, gosh, what was it? Early 2000s, 2001 maybe?
Oh, yeah, for sure.
Yeah, maybe late 90s, maybe 98.
I'd say closer, late 90s.
Yeah, we started practicing together. I had a medical practice. Dr. Hoven had a chiropractic practice, both very successful. And we recognized that we could do better by our patients. Mm-hmm. And we got to talking and we decided to put it together where we were still our own businesses, but we wanted to practice in the same office to bring that to our patients. So the best of both worlds was right there. That
was kind of the beginning of what we'd call now integrative medicine. Can you give us a little definition of that that's a little more expansive? It's not just chiro and MD. There's so many beautiful parts now to this multidiscipline integrated care.
Yeah, I like to look at integrative medicine as kind of like the physical, mental, emotional aspects of medical care. There's a physical aspect, and a lot of that may be the movement type of therapies, maybe physical therapy, maybe chiropractic with some of the manipulations, or tissue work or ligamentous stuff. So there's a physical, and I can elaborate on that a little bit more. There's a medical aspect of what people go through, and that is just plain sometimes where you have pain and you need relief. You have a structural defect and you need it fixed, and that's more of a medical type twist in my mind and how I look at it. And there's an emotional aspect. There's definitely behavioral and psychosocial aspects to care that are biological. They actually involve neurotransmitters within your body, and they are affected by different aspects of relaxation or different aspects of emotional release. And I think until you get all of those to align, you really don't get the full picture of healthcare. And to me, that's, in a short and easy way, that's integrative medicine.
And, I think where this really starts taking us is you've done a lot of lecturing, and your specialty was in trauma in the ER.
Yes.
And took care of people from gunshots to food poisoning to, I'm sure babies coming in, all the stuff. My training is in sports injuries and some trauma stuff on that side with acupuncture, et cetera, et cetera. And what I think is really important for the audience to start getting a hold of is when you put these tools together, and like you said, physical, and then the mental emotional side, the chemical side, is that it's almost like a continuum, right?
Right.
Like start kind of conservative and work your way through. Can you give your ideal model if someone hurts their back, their neck, if something happens, what does a good healing model look like?
You know, it was funny as you were saying that, as you were saying it's like a continuum. I was sitting over here thinking that one of the best ways you could describe integrative medicine is almost a color spectrum, like a rainbow almost. It's sometimes it's hard. One color blends the next, blends the next, blends the next. It's not red and then orange, and then it's not boxes. And so how that healing comes together for me is this, and that's why integrative medicine is just so critical. That's why what each provider has to offer is so important. There's a time where you might be injured and maybe movement will help, but you just can't. Mm-hmm. You just can't. There might be a time where muscle spasm is so painful that for me to ask you to do some sort of physical therapy is just not realistic. In fact, maybe I'm causing more problems. Similarly, there's a time where another pill isn't the cure. There's a time when a deeper needle injection with another medication in it is not what your liver needs or your kidneys need. There might be a time when it does need that to get that week or two of reprieve. And so what we do and what we believe in, and this is not just for our injured people that we take care of here in our law firm. This applies to the injured people we took care of in our medical practices. We see that continuum and we see where is that point where, okay, the pain's managed, let's do some movement. Where's that point where a tissue is no longer edematous or inflamed and we can start a healing process? Where's that point where it's edematous, inflamed, and if they do something different, they're going to make it worse with more inflammation, right? And so I see integrative healthcare as the perfect mix of all of that, and I love working with providers who see that bigger picture. That's why, again, that's why you and I related so early on. I think you saw the same thing.
Agreed. And here's an example. I was reviewing some cases last night before I went home. And one of the cases, it's interesting. Sometimes people have an idea of what they want for care, right? And so if they have an idea of what a care paradigm is, they're going to follow that. And for us, and our attorneys that are guiding them legally, and then the providers they choose to work with, we can say, hey, you should maybe look at trying this type of care, whatever it might be. Mm-hmm. I was reviewing this case, and the person is basically not getting better, still having headaches every day. And one of the paralegals, our lead paralegal, senior paralegal, calls me and says, hey, can I ask you some questions on this? I said, sure. So she says, yeah, this person's still having headaches. I said, when was the accident? It was in October of last year. So now, we're talking 6 months out, and headaches every day. And I said, well, are the headaches getting better, same or worse? Where are they located, et cetera? So, our doctor questions.
Yes.
And she said, I haven't asked that. And I said, well, we need to find out that kind of stuff, severity, how much through the day, and all these things. Because if a daily headache hasn't changed over 6 months,
right,
there's a problem.
That's right.
And it turns out that the only care that this person has had was going to the medical doctor and then to a neurologist who prescribed pain meds, but yet at the ER they diagnosed it with cervicogenic pain, meaning from the neck.
From the neck.
But there was no conservative care done on the neck, presumably because the person said, look, I'm not into massage, chiropractic, physical therapy, acupuncture. I just want to go the medical route. Right. And so I think it's a perfect example of saying on this continuum that we talked about that when range of motion is decreased, when muscle spasm is there are tools for each of those phases that you use, right? I'd like for you to discuss some of the things from conservative care through pain management with the injections, because a lot of people don't know what those things even are.
Right. Yeah. There's a lot to discuss there. So the basics, as we know with regard to the medicine, but for our viewers is there are periods. Here's one small example. A lot of times, immediately after injury, what your body does naturally is it wants to heal an area. So what it does is your vessels dilate, and it sends all these pain mediators within our body, our natural chemicals, if you want to call them that, to the site. It sends white blood cells. It might send, neutrophils, eosinophils, whatever it needs to there. It's all hands on deck. We're going to heal this area. It's injured. It's inflamed. Vessels are swollen, and sometimes with either how medical doctors practice or particular areas of medicine practice, or sometimes just based on lifestyles, just old things at home that people think. What do? They put a heating pad on it. Well, what's that do? It increases more blood flow. It dilates the vessels more. It causes more edema. That's where basically everything flows to an area so much that we start putting fluid into the tissues. Now the tissues have a harder time recovering. The area is more swollen. The person experiences more pain. There's pain on more nerve endings. There's a release of more chemicals, chemical neurotransmitters in our body. And we get this vicious cycle going, right? At that point in someone's life, and the same thing could happen if you tell them, how you heal that up is you exercise it. Same thing. With integrative medicine and with providers that see through these eyes, the medical doctor may go, okay, listen, what do I have to calm inflammation? Well, let me give them an anti-inflammatory. And a chiropractic provider or a physical therapy provider might say, what do I have to help with local inflammation and edema? Okay, well, let's do ice baths at a certain timing. And then another provider at that point might stand on the sidelines and say, perfect, you guys are doing a great job. And this is that continuum we talked about. It might go through that phase. Now all of a sudden, they go back and they see the physical therapist, by way of example in this case, and they've not moved for a while. The edema is down. We stop the big dilated vessels and the blood flow and the tissue leaking with ice. Mm-hmm. And now the therapist might recognize, wow, we're having some restrictions in motion here. We better start some stretching of the tendons or ligaments or wherever it is in a particular area of injury. Or a chiropractic physician may see that and say, hey, we're getting some immobility here. And we need to make sure these segments stay mobilized because, as you know, if you immobilize anything for too long, you lose motion, you lose range of motion, you have permanent contracture, permanent loss of motion. And at that point, a chiropractic physician who understands the proper way to mobilize an area, not too much, not too little. We don't want to re-injure, but we have to do something. That might be the right hands for it to be in. And then maybe after that, maybe it's back to the physical therapist for some strengthening because, there's a lot of statistics out there. For example, if you're over age 60 and you're in a hospital bed for 10 days, you'll lose 50% of your muscle mass.
Wow.
50% in 10 days. I mean, it goes like that as we get older. Well, if I was sitting there giving them the anti-inflammatories the whole time thinking I'm curing them, or if you were sitting there keeping the joints moving thinking you were curing them, neither one of us have really done that person a whole lot of good. Mm-hmm. They need that therapist, the physical therapist, who's going to help strengthen them. Now, along the way, through this course of stuff, the person's out of work. Along the way, the person's no longer doing the things they enjoy with their loved one, their husband or wife. Maybe they don't have intimacy as they had. Maybe they're a little bit grumpier than they have been because they're in pain. They're disappointed. Well, perfect spot for someone who can work on mind and emotional balance. I know your wife, Shauna, does a lot of this and combines it with her acupuncture. And my gosh, we have heard so many wonderful things about how she works with people in that aspect. And medically, it's well proven. There are many studies that we have neurotransmitters in our bodies that react based on our mindset.
Yes.
Based on our mindset. That's why when you get excited and you get that burst, you can sometimes get a flush of embarrassment or a rush with a fight or flight response. That's how strong our bodies are. And so, that's walking through one example. I hope I've answered that question.
No, that's great. And to jump on board with the emotional side of things, I know there are lots of studies and research out there that talk about chronic pain, and that when you have chronic pain, you're basically, even if the body isn't quote unquote feeling the pain, the thought of remembering what that accident was like and not having gotten through that, the memory can stimulate the same neural pain pathways.
Yes.
And that's where people like we use Dr. Ron Schwenkler here a lot, that people will send them to him if they need that conversation piece to say, how do you deal with trauma? Because the trauma gets saved literally in the cells and in the tissues that it experiences. And if you don't work back through that, all of a sudden, every time you think about it, now that chronic pain lives. And as you know from treating so many thousands of people, chronic pain can affect your life at every level, right?
Boy, chronic pain is, it's getting more recognized now. I think amongst providers, amongst people, really. It's one of the hardest things we face in trials that we go to, though, because I think that it's still looked at differently. Let me explain. If I told you I had cancer and I was going to go undergo care, your first thoughts might run through your mind is chronic. Like you start thinking long-term, how many years, how long's chemo, can they do surgery, what's he going to have to be on forever? And people who have undergone or suffered from those types of illnesses know that it's not a in and out. All right, you think chronic.
Yes.
But people don't respect just pain. Just pure chronic pain and what it does to your system, how it burns out all of those internal neurotransmitters, how the receptors just get bogged down all the time, getting saturated, how people's pain levels change, how their their mental capacities change along with their physical capacities. Now that's starting to get out more, but I'll tell you what, if there was any one thing that I wished was, I guess in law, the crossover law of medicine that was a little bit better recognized. As medical providers, you and I can have a great conversation about chronic pain, what it does to people, how it works, what good solutions are. Try to explain that to outside people and they don't get it. They frequently think the person's complaining. Maybe they want more money, so they're acting like they have pain. They want to act like they want to use this as a crutch because they've been injured. They want to act like they can't do their job. I'm telling you, it's not the case. People get true joy out of doing what they enjoy.
Yes.
Their social activities, their recreational activities, their families, their occupation, like you and I, we enjoy our job.
Right.
People get true joy out of that. And nobody wants to go pretend for months or years that they have some sort of injury or pain. They just don't.
Yeah.
It's like if you sat there and tried to pretend with your children, your family, that you were from Texas, you want to talk a little Western slang, and you can do this. You can only do that for so long.
Yes.
You go home and you can only play the accent for so long. You're like, screw it, I'm back to being Jim again, right?
Right.
And that's how it is with chronic pain. Those people are not pretending.
Yes.
And it's life-changing, life-altering. I mean, you've dealt with it a lot. In fact, I know you've helped maintain a lot of people over the years from really probably tipping over the edge.
We try to, and when we can't, that's when the thing, so, whether it's chiropractic, massage, therapy, acupuncture, PT, all of these things. And one thing I love in the pain, now that you mentioned this, in maintaining pain and function, is taping, specifically with kinesiology
yes.
tape. I had the joy and the blessing to be able to teach taping for rock tape around the country for many, many years. And I
yes.
loved that when incorporating these tools, right? So whether it's stretching and exercise and manipulation and acupuncture and taping, all these things make a big difference. But there's sometimes when the injury is more severe, or there was a pre-existing injury where there was damage previous, and then you put another trauma on it. And that's when things like going to physiatrists that do different ESIs and things like that become important. Would you just talk to the pain management tools that are out there, what they are, how they work, and these kinds of things?
Absolutely. So one of the things, Dr. Hoven just used the term ESI for epidural steroid injection. And it's one of the things that we see pain management providers use a lot. We see a lot of them do facet injections. We see...
which is part of the spine, right? It's the joint of the spine.
Right. And what the deal is with some of the pain providers is really has become its own profession this way, particularly those who are doing interventional pain. What they found is this: there are certain structures in your body, particularly the spine. That's why a lot of this conversation is resolving around this, but we could go to any joint or area of the body really, but let's use that as our example here. That in order to get better, like truly better, you're going to have to build some core strength. You're going to have to build some mobility. You're going to have to build structural support around an injured area. Now, if you had a broken bone in your arm, and I asked you, listen, in order for that bone to get thicker and denser and heavier and recover around that fracture, I just want you to move it a whole bunch. People will go, what? You're going to move. It's just excruciating, piercing pain. That's why when you break a bone in your arm, they splint it. They hold it from moving for you. That's why it gets casted. Well, what do you do with somebody's spine? You can't. You just can't. You can't put them in a whole body cast.
Right.
And so herein lies the absolute strength of interventional pain and the pain providers and people who have chronic pain, for example, with their spine. They go in and target the area causing the pain. So we can look at the facets, as you mentioned, it's an area of the spine, where the spines, your spinal vertebral bodies sit on top of each other like blocks, just like a chain of blocks. And they're joined together with bones that drop off of each one to the next one below. And they just form a stack that supports itself. But where the bones come off that join the other bone, they meet up. Where they meet up, that's a joint. It's almost like a knee joint or an ankle joint. And that joint where they meet up, if that gets an injury, people just can't do that strengthening. They can't do that core stuff they need to get better. So the interventional spine physician goes in and sticks a needle into that joint, puts a little medicine there, and the person goes, oh, hey.
Pretty quickly too, right?
Immediately.
Right.
Yeah, I mean, pretty immediately. It's, they get really nice effects and fast. And then once they can move, they can start to strengthen. They can start to stretch. They can start to recover, which they couldn't do when they were having all that severe pain. And you can apply the same example to the disc. A disc, everybody's heard of a friend who's herniated a disc. I know, worked on many of these people. Man, disc herniations are painful. How do you get that pain away long enough to allow somebody to recover? Well, you get an interventional pain physician, get him to go down and target that, slide a needle right down there to the hot spot, put out the fire. Just put out the fire. And once that fire's out, that person can start doing things that they need to do. The pain comes back and it may need to be repeated. So they can do some more. And then it's an opportunity to recovery without everybody just getting a spinal fusion.
Right.
I mean, what a bad alternative choice.
Yes, that's going from 0 to 100, right? And so we've talked about this continuum of starting with what we'll call our conservative care and then moving up into even, I think medicine is kind of in that transition from conservative care with exercise and chiropractic, whatever, and some medicines to go along that, and then into these pain interventions. But sometimes people need a surgery to fix this, right? What would be indications when a surgery would be necessary from a traumatic-based injury when these other things like, hey, either didn't work or let's skip those because the damage is too bad?
Well, and carrying along exactly what you said with the continuum. So one of the great things about the spinal interventions with injections, we said, is they help you know that you're in the right spot.
Yes.
And because if you're in the right spot and you put medicine there and the pain goes away, it's a pain generator. So what happens is then the pain comes back and you give them a little more medicine there and it goes away again. What you're trying to do is what we had talked up to the point of our conversation before, which is you're trying as conservatively as possible to get them better. They stretch, they strengthen, it comes back again. You do the same process. They stretch, they strengthen, they work in the core, it comes back again. Sometimes there's a point where you're like, okay, I can't do this for life or I'm going to now start some negative effects on you. But I know where the pain's coming from. I can tell you the spot. And the person's like, yeah, you know the spot because you keep fixing it every time, just temporary.
Right.
When that happens, that's when surgical intervention is appropriate. Because then a surgeon can go in with full confidence and go, oh, that's the bad spot? Let me cut that out of there. That's a bad spot? Let me put in an implant. That's the bad spot? They can treat that. And so I find that actually a lot of surgeons would mandate interventional stuff first because they want to make sure that the target that they're about to go change forever is the target. And that's where surgery has its place. And then, surgery itself has come a long, long ways. Thankfully for us, and who knows where it'll be after our time.
Yes.
It's come so far. You remember when you and I first had our clinics together way back when, they weren't doing, artificial discs.
No.
We'd never dealt with that. Now the artificial discs have come so far that they're actually putting them in various levels in people. And, you want to explain the artificial discs and how they're working? Do you want me to explain that?
No, you explain that. That falls right in your wheelhouse.
Well, so what it used to be for years, if you had a disc, so there's a bone, a vertebral body, and there's one below it. That's the blocks we talked about. And in between it, there's a nice soft jelly cushion. And the thing that people use often as an analogy is like an Oreo cookie, where the top black piece and the bottom black piece would be the bones, and the white in the middle would be the Oreo of the Oreo is the equivalent to the disc. And if the vertebral body's squished together and they push that disc out, if the white material of the Oreo got pushed out, the problem is right along that spine, actually coming out of the posterior aspect of that canal, there are nerve roots. So using the Oreo analogy, if you tapped on the Oreo and the white stuff squishes out, if it touches up against anything, that's going to be an area of excruciating pain in the spine. So what they found is, gosh, what can we do with these discs? So used to be you'd go in, it'd almost be like separating the Oreo, cutting out the white, and then sticking the Oreo, just the two black pieces together, called the fusion. That's what they did with the spine. Cut out the disc, fuse the bone above to the bone below, because it has no cushion between it now, so we don't want it grinding back and forth on each other. We'll just fuse them together, put in some screws and some rods and stick them together. And the problem is that when you do that with the spine, you change a lot of spine dynamics. The forces at other levels of the spine become different. The transmitted forces elsewhere become different. The scar tissue used to be amazing and encroach on nerves and really just be painful. And now during our time, they've come up with these artificial discs. Now what they do, they actually go in, they elevate the vertebral bodies. It'd be like taking the Oreo and lifting both black pieces up. They go in where the white Oreo piece used to be, which is the disc. They scrape it out. They put in a brand new piece of Oreo, brand new white, and set the two black pieces back on each other. It's an implant. Now, I made that sound easy using the Oreo analogy, but it actually is fairly easy. I mean, I think the last one I saw, it took the surgeon about 35 or 40 minutes to do.
Wow, I didn't realize they were that fast.
In operative time, yeah, very fast. They literally, once they have exposure of the disc, they literally put like a little elevator in there that goes in and it lifts the bottom bone up and lifts the top bone up, pushes the bottom bone down. They increase the space. They clean it out. They grind in a little, like a rail, almost like a groove. A groove is a word, into the bone. And this new implant just slides in it like a train would go on rails. The new implant just slides in the two grooves that they've placed in the bone, and when they let it back down, they sit perfectly. Now here's the great thing: this artificial disc where they sit on each other, they put one in the top aspect of the bone where it meets the lower aspect of the bone. They put one, and it moves, so it maintains its motion. They're no longer stuck together, immobile. They actually can flex still.
Yes.
They can move. It actually is the closest thing to restoring the natural human anatomy. In fact, I actually had one spine surgeon tell me that he made him better than God did. But he thought it was that good. He thought it was that effective.
And that's oftentimes what we see from trauma. I think it's really important as we're kind of trying to tie all this together now. From our perspective, what we see every day is someone has gone through trauma. Typically, again, what we see a lot is car crashes or falls, that kind of stuff. And these joints, whether they're in the spine or outside in the ankles or the knees or the hips or the wrists, they're not designed to undergo so much pressure, right? Can you just describe how a joint can get hurt from a car crash and just what happens to the mechanics, to the physiology of the ligaments and the muscles around that joint?
Yeah, there's so many things that happen, and as you mentioned, like in a car crash. And let me start with this. How many people in your life, if you just sit here and think for a minute, just take 20 seconds right now while I'm doing this, and think of people in your life who you know that suffer from pain in an area, and they can point to something in the past. We all know somebody.
I definitely got a few in my mind right now.
Absolutely, me too. They'll tell you, I used to really enjoy running, but I hurt this knee one time playing football. It's an old football injury. It's messed me up forever. I used to really enjoy, hiking, and then I remember that I was in this car crash and I had this back injury, and they had to actually replace one of my discs. And I don't jog anymore. The fact is this: trauma is lifelong. It's absolutely life altering, and it's changing, and it changes anatomically. And I'm going to explain the medicine behind that here in just a second. But what I first want you to start with is that trauma is not like a car dent, where car gets dented, you pull the dent out, you repaint it, and you really can't tell. Trauma to the human body, because the human body is put together so perfectly, builds upon itself. So now let's talk about the body itself particularly. For example, if you were to injure your knee and tear a meniscus in your knee, as the meniscus would go to heal, the knee is put together perfectly. So a meniscus, just to explain quickly, for those of you who may not know, your upper bone, your femur, goes down and meets the lower two bones in your leg, the tibia and the fibula. Where it meets up with the tibia, which is the primary surface it meets up with, two surfaces come together. We've all heard the term bone on bone. Bone on bone is not good. When you rub two bones together, what they do is they get inflamed. When bone gets inflamed, what it does is it deposits more bone. So you take a surface that was very smooth, or supposed to be smooth, we were made with it smooth. If you put two bones together, you have this rough, terrible surface. The analogy I used to always use with my patients is this. If you took two pieces of glass and you put them together, and you put a little bit of water between the two pieces of glass, the two pieces of glass almost stick together. Mm-hmm. Just real nice. If you move the two pieces of glass, they slide on each other just beautifully. But if you take those two pieces of glass, you put the water there, and you just sprinkled in 10 grains of sand, can you imagine the screeching that occurs between those two pieces of glass as you roll them back and forth, and that sand between the glass? That's exactly how our joints function. They function that way in the spine. They function that way in the knee. They just function that way. So when we get injured and we create that sudden shear force across a bone surface, or we alter the pull from one bone surface from another, we often have created how they rub on each other a little differently. We've created this possibility for these rough edges, like the sand between the two pieces of glass. Now, our body doesn't know any differently. It just sends healing. Man, our body's about healing. The human body's remarkable. And it starts sending more bone over there. And it'd be like if between the two pieces of glass with the sand, if the body saw that, it would think that the cure was sending more sand. Right? And that's not the cure. And so that's why these injuries are lifelong. They alter the structure, and the body's response to it is it's trying to do the right thing, but it's so overwhelming that it starts laying down bone, and that's where we see people with arthritis. You know, if you talk about arthritis, what is it? Thickening of the bone spikes, bone spurs, bone bridging, where it actually grows across. That's what arthritis is. Well, how does that all get started? And in many cases, it starts following trauma. And then they have to live with that for life, because restoring things back to normal, restoring things back how we were made, is impossible.
Yeah, it doesn't go in reverse well.
No, it really doesn't. And so that's why trauma is important. I think that's why people need to understand that these injuries that we see, and why we push for people to get good care. We know, as physicians, you and I, that they're going to live with this for life. I don't want them remembering Ramos' law for their pain every time they step on their foot and they fill up through their knee.
Yes.
I want them to remember us for what we did to get rid of that, what they experienced for 3 months, and they said, I never want to live like this.
Yes.
That's why we try to get people in excellent care. That's why we really tell them, listen, don't rush to a settlement here. Rush to heal.
Right.
We'll get you a settlement. Rush to heal.
And I think one thing you threw in there, and it was subtle, and so I want to bring it to light, was when you encourage people to go through the process and to rush to heal, is really the patient or the person-centered care, meaning they have to do their part, right? Like, we can't depend on these wonderful surgeons, these wonderful technologies. The patient has to keep moving. They have to look at getting good rest. They have to get good stress management programs in place, because all of that changes inflammation and helps with healing if you can mitigate that. And so I really want to kind of close this with saying people have more control than they think. Even when they've gone through trauma, their mind may tell them they can't do anything. And we need to find that balance of them getting good care and following the doctor's orders when they tell them to exercise or to stretch or to do this or to take their medicine or, go to their appointments. And then to just do the right things of getting outside and moving around and being with people they love. Like, the patient has so much control in the way their body heals. At least that's been my experience.
Absolutely. Yeah, you hit it right on the head. And I would also end in saying there's a lot of places in life that you might be impatient, you might experience impatience, rushing home to dinner, going to an appointment, whatever. There's a lot of places where you might be able to cut corners in your life. One place you cannot cut corners, or you will live with it for life, and sometimes you might live with it for life even if you don't cut corners with some of these injuries. But the fact being is, one of the areas you will live with it for life is if you are impatient with your recovery, if you want to rush, avoid care, not go, not do what the doctors say, there's a price to pay. And the unfortunate thing is that price to pay is not an extra week or an extra month. It's a lifetime.
Wow, that is powerful. And I think that's a great place for us to end this this topic today. And so hopefully if you've been exposed to or experiencing chronic pain or traumatic-based pain, that this give you at least some starting points to ask. And if you have more questions, please reach out to us. You can reach out to me directly, jim@ramoslaw.com. And Dr. Ramos and I meet all the time. We can make sure that we get you some answers. If there's other topics on health-related matters that you'd like to see us talk about, let us know. We're happy to do that too. And please, a couple more things that I would just ask while I'm asking. Leave us a 5-star review if this has been helpful. If you think it's good, let people know, because that's how we build our ability to make a difference. Not only that, subscribe to our channels, whether it's YouTube or even on, I guess we're on TikTok now. So look all over, wherever you see us. If you would just subscribe and participate and engage, man, we would love it. So thank you so much for being with us. There are show notes that we'll be putting in here and links to all the things that you might need. But otherwise, again, go out there, take care of yourselves, take care of each other, and continue making a difference.